Probably the most popular non-surgical procedures are some sort of laser procedure or injectable or filler. And when I look at fillers, I think about fillers in two categories. Some fillers are volumizers and some fillers are refiners. And that's because as we get older, two things happen to our facial structure. We actually lose facial volume. We lose bony volume. Our chin gets smaller, our cheeks get smaller. We lose some subcutaneous volume in the cheeks, and unfortunately it gets deposited in the jowls and the neck often. The other thing that happens is patients develop a lot of fine lines and wrinkles, lines around the mouth, lines around the eyes, the crow's feet. That is where you need a refiner. That is where you need some sort of filler that is good to be used for fine lines. So basically, to really use fillers as a rejuvenation type of procedure, you need to both restore volume and to also refine the appearance of the skin. Okay? There are many fillers out there right now. The ones that I like to use in my practice are basically Juvederm, which is a non-animal derived hyaluronic acid. It's a natural substance that occurs in our skin, although the hyaluronic acid that's in the syringe is lab derived, so it's not from a human source. The other two fillers that I use, which are volumizers, are either Sculptra, which is poly-L-lactic acid, or the patient's own fat. The nice thing about poly-L-lactic acid or Sculptra is that it doesn't require a surgical procedure to get it from the patient, whereas harvesting the patient's fat does. What's also nice about it, even though it gives us a lot of volume and it lasts about 2 years, itself is gone in 6 weeks and is replaced by the patient's own collagen. So in both cases, whether I'm using the patient's own fat or collagen, which has been induced to be laid down by the body as a response to the poly-L-lactic acid, you're left with very natural filler that is your own tissue and your own substance. A lot of the other volumizers out there leave foreign bodies in there that I am not as comfortable with.